Thank you, Rena. Welcome, everyone. We're so happy that you could join us today. So thanks for making the time to be with us. My name is Lynn Brettel. I'm the director of the State Adolescent Health Resource Center at the University of Minnesota. Today's webinar is sponsored by the Adolescent and Young Adult Health National Resource Center, of which SARC, my center, is a partner. One of our 5 overarching goals of the National Resource Center is to advance young adult health by increasing the number of states that address a Title V young adult focused performance or outcome measure. Excuse me. So to that end, the original intent of this webinar series that we put together was to provide our primary audience with resources that would encourage discussion about how we could engage young adults and how by viewing young adults as a distinct population in our programs, we could support our partners in the adoption of a young adult focused strategy. So primarily at SARC and the Adolescent Young Adult Health Resource Center are the folks that we give support to in terms of training and technical assistance are state level adolescent health coordinators and other Title V maternal and child health, typically state level professionals. So that's the audience for whom this webinar series was originally designed. However, we know based on the registrations from today that we're reaching a much broader audience today, and we're really thrilled about that. We're happy you could all be with us. So I just wanted to mention that, and keeping in mind that while some of our examples might be focused on state level public health strategies and interventions, we're definitely aware that this webinar is reaching us all at a very timely point when we're all concerned about how we support young adults and the other adolescents that we work with, both personally and professionally, in response to the current health crisis and all the changes we've had to make in response to COVID and coronavirus. So we will definitely be keeping that in mind and have adjusted our agenda today, as we know that we're reaching a much broader audience than our original intent. So that's great. We're happy you could all be here with us. So having said that, I'm thrilled to introduce our 2 primary speakers today who are going to be sharing some great resources. We're really grateful for their time and expertise on this topic of mental health and suicide prevention among young adults. So you see on your screen, our 2 speakers are Carrie Nickerson, who is the Director of Grantee and State Initiatives at the Suicide Prevention Resource Center, and Sarah Gorman, who is the Director of High School Programming at the JED Foundation. Carrie and Sarah will probably explain and give you some more background about their organizations, but I just wanted to give you all a little bit of information about who Carrie and Sarah are. Like I said, Carrie is the Director of Grantee and State Initiatives with the Suicide Prevention Resource Center, which is a project of the Education Development Center and is supported through a grant from SAMHSA. Ms. Nickerson serves as the Director of Grantee and State Initiatives, where she leads the work of the team at SPRC that provides consultation and support services to state agencies, community organizations, tribal nations, and institutions of higher education in implementing effective suicide prevention strategies. She has over 15 years of experience in mental health promotion and public health. She's a licensed social worker in the state of Massachusetts and has a Master of Social Work and Master of Public Health from Boston University. And Sarah Gorman is with us from the JED Foundation, where she was before that working with Johnson & Johnson Global Public Health and was responsible for a large community-based mental health effort in sub-Saharan Africa. As a public health specialist, Sarah is also an author and has written extensively about mental health, global health, and the intersection of public health and psychology, among other things. Her book, Denying to the Grave, Why We Ignore the Facts That Will Save Us, is published by Oxford University in 2016 and explores the psychology behind irrational health beliefs and decisions. Sarah's work has appeared in Time, The New Yorker, Science, and many other publications, and she has a PhD from Harvard and an MPH from Columbia University Mailman School of Public Health. So we are really grateful to have Carrie and Sarah with us today, sharing their time. And with that, I will turn it over to you, Carrie, and look forward to your presentation.
Great. Thank you so much, Lynn. It's great to be with all of you today. So as Lynn mentioned, I am the Director of Grantee and State Initiatives at the Suicide Prevention Resource Center. Let me just share my slides with you. Give me one moment. So today, I'm going to talk to you a little bit about what we know about young adult mental health and suicide prevention, and also a little bit about what we know works in terms of preventing suicide, and start the conversation about what possibly you can infuse within your work to help prevent suicide. So I know many of you don't work in suicide prevention in your everyday work. But I wanted to just hear from you before I go into my presentation, or if you have anything that you're doing right now that relates to suicide prevention, please type it into the chat box, just so I can get a sense if anyone's doing work right now, what kinds of things you may be doing at the moment. Sorry about that. For some reason, I can't actually see the chat at this moment, which is not so helpful. Oh, so it looks like someone raised their hand. So thank you for that. I'll keep moving along since I can't see the chat, but hopefully you all are doing some fabulous work that I can hear about a little bit later. So before I get started, I just wanted to mention that SPRC is federally funded by the Substance Abuse and Mental Health Services Administration, and what I'm presenting today does not represent SAMHSA's views or opinions. So a little bit about SPRC for those of you who are not familiar with us. SPRC is the only federally funded resource center dedicated to advancing the national strategy for suicide prevention. So we really serve as a destination for anyone who's looking to work on suicide prevention. We like to say we help the people who help the people. On the ground. So as was mentioned when Lynn introduced me, my team primarily focuses on providing consultation and support to SAMHSA suicide prevention grantees, including Garrett Lee Smith Youth Suicide Prevention Grantees, which focus on youth aged 10 to 24. And we've been supporting these grantees for the last 15 years. But we also provide support to state suicide prevention coordinators and other organizations that are looking to do suicide prevention as well. I'm going to walk through a little bit later some of the resources that may be particularly useful to you all on our website, but I encourage you to go to sprc.org and just poke around at your leisure after this webinar. So let's talk a little bit about what we know about suicide among young adults. So suicide is the second leading cause of death in youth and young adults, second only to unintentional injuries. So you can see on this chart, the suicide blocks are in darker green. So it's not until we reach the 35 to 44 age category that we see suicide moving down the list in terms of leading causes of death. And between 2008 and 2017, suicide rates increased among all age groups. But as you can see here, young adults, which is that dark black line at the bottom, has risen precipitously in the last few years, though all age groups have seen an increase. And this graph illustrates the percent change in suicide rates from 2008 to 2017. The suicide rate for ages 15 to 19 and also those 20 to 24 increased in 2017 to its highest point since 2000, with increases that we've seen especially in males in ages 15 to 19. So you can see here that unfortunately our youth, we've seen the highest percent increases. And one particularly high-risk group is our Native or Indigenous youth. On this graph, the general US population is in black, while our AIAN populations are in green. Among the AIAN populations, suicide rates actually peak in adolescence and young adulthood and then decline, which is actually different from the overall US population where we see suicide rates peak in midlife. So young adult age frame is a particularly high risk time for our AIAN youth. And then these pie charts outline a little bit about means in which are used in our suicide deaths among females. Young women are most likely to die by suffocation, followed by firearms and poisoning. And I'll just leave this for a second. I know there's a lot of numbers on this screen. And then for males, firearms really remain a consistent means of suicide across age groups. Firearms are the most lethal means that are available, so this is why we see more completed suicides among men. I'll leave this one up as well because there's a number of numbers on this one as well. So looking beyond just suicide deaths, which suicide deaths are relatively low overall, rates of suicidal thoughts or attempts are often higher. So as you can see from this graph, both rates of suicidal thoughts and attempts, typically we see them declining with age. So with our young adults having the reporting the highest rates. And then again, also looking beyond just suicidal behavior, we know that a lot of young adults are struggling with other mental health concerns. So these data were taken from the American College Health Association's National College Health Assessment. And in the last 12 months, college students completing that survey said 45% felt so depressed it was difficult to function. At some point in those 12 months, 66% felt overwhelming anxiety, 66 also felt very lonely, and 56% felt things were hopeless at some point during that time. So let's talk a little bit about risk and protective factors. So suicide is a complex public health issue, and no one thing is the driver of all suicides. Instead, each individual's risk for suicide is dependent on the existence of both risk factors for suicide and also protective factors that then in turn buffer that individual from suicide. So I'll again just leave this slide up for a moment so you can look at it. Let me see if I can see the chat. I cannot, unfortunately. What I was going to ask you if I could see the chat was, obviously the current situation that we're in with COVID-19 could influence these risk and protective factors. So maybe feel free to continue to chat in if others can see chat. But I'm curious if you can think about areas here that may be influenced by what we're experiencing right now.
Carrie, this is Lynn. I'm sorry to interrupt. I thought I would just reflect a few things that are in the chat box since you're not able
Sure.
to see it. There's quite a few folks who work with it seems like school staff who work with young people in middle schools and high schools who are on the call. Many of them mentioned being mental health first responders, doing signs of suicide, QPR. These are a couple of the programs that I see mentioned. There was also one question someone wanted to clarify. Is dying by suffocation, is that the same as hanging? Could you clarify that?
Yes, hanging is completed. It is under that suffocation designation, though there are other ways as well that someone could die by suffocation. But yes, that's included.
Thank you.
So just thinking about those protective factors, so those positive school experiences is a protective factor, especially for those in secondary school. So being away from your friends and those positive school experiences obviously are something that might be negatively influenced right now by what's going on. Also, that risk factor of social isolation kind of goes hand in hand with that piece. So we want to be looking out in this time for that. Um, Also, certainly access to behavioral health care. We're seeing a lot of healthcare organizations having to turn to telehealth, but access might be an issue at the moment for many of our youth. And then also, I recently saw that the month of March was one of the highest sale months for firearms possibly ever recorded. So we potentially have a higher access to lethal means at this moment. So all of these things kind of combine together and having to really kind of think about how we can effectively approach suicide prevention right now. Lynn, was there anything else about risk and protective factors that people were chatting in before I move on?
Lots of what I'm seeing is similar to what you're talking about, people losing the protective factors and connection to the adults in schools that
Mm-hmm.
are helping them. Someone commented that in LA County, for example, they have seen dramatic increases in suicides among high school students that
Mm-hmm.
have dropped out during school vacation periods because they don't have access to their school personnel. So it's, particularly vulnerable time. And so this seems like this would mirror that. So
Wow.
several
Yeah.
things that are similar to what you're mentioning.
Okay. Well, in just a moment, we'll move on to some strategies. So it's good to hear that a lot of you are already doing some suicide prevention work already. Um, In the interest of time, we won't go too deeply. And again, I can't see the chat. I was going to ask you another question, but in terms of unique factors with young adulthood, as you all probably know, this is a unique time in terms of developmental transition. So there's a lot of associated shifts with social connections and responsibilities and obligations as young adults navigate adulthood for the first time, or change locations because of going to college or going to another location. So these changes can in turn erode those protective factors that may have been developed in their high school years and amplify certain risk factors. Also, we know that this time of young adulthood is a time where we start seeing some mental health disorders. So it's taking in turn those make a combination where we really do want to think about how we can support our young adults and promote positive mental health. So I know the statistics that I presented can be a little discouraging, and what I want to kind of pivot to is that we do know that there are things that we can do to prevent suicide. So SPRC has created a framework for preventing suicide in communities that includes the three elements that you see on this slide. And I know that many of you are not focused on suicide prevention and mental health promotion in your daily work, but again, hopefully you'll see some things in the next couple of minutes that you'll be able to think about that can be infused in your work. So the first guiding principle in this framework is that effective prevention requires that we take a strategic planning approach to identify those who are most at risk, identify what the key needs and gaps are, and what interventions can address those needs. I know many of you are probably familiar with strategic planning, so in the interest of time, I'm not going to delve into this too much, but we also do have a free online course about strategic planning for suicide prevention if you are interested. The second principle is that we need to employ a comprehensive approach with multiple strategies to effectively prevent suicide. So this comprehensive approach was adapted from the US Air Force Suicide Prevention Program, which was found to successfully reduce suicides. And SPRC and JED Foundation actually first adapted this model together for college students, and then we later adapted over at SPRC this model to fit a lifespan approach. But as you can see from this model, we want to employ strategies that help recognize those at risk for suicide and encourage them to seek evidence-based care, but also work to ensure that transitions in care, such as for those who are being discharged from inpatient care, are done in a way that's coordinated and reduces gaps in treatment. We also want to work to reduce access to lethal means, such as firearms, and also work on some upstream approaches such as development of healthy coping strategies and life skills to navigate life's challenges and hopefully prevent someone from going down that continuum into an acute suicidal crisis. And also, very importantly, we should be considering ways to promote meaningful connections between young adults and those trusted adults, peers, and other supports. So, Lynn, maybe I can tap you again for chat. Thinking about your work, I know Lynn mentioned many of you are already doing some trainings, gatekeeper trainings as we call them, in terms of recognizing warning signs for suicide and how to refer individuals who are at risk to care. But what are some things in looking at this model that you think you potentially could do in terms of your work? And Lynn, if you happen to see anything, any chat, please let me know.
Absolutely.
And Carrie, while folks are taking a moment to type in the chat, I think if you roll your mouse up above the sharing line, the
Yes.
tools that expand, there's a dot, dot, dot to the far right. If you click that, I think there's a chat option.
Yep. I had already tried that, and it worked when we were, oops, it worked when you and I were practicing before, and now it is not. And now my screen is acting really funny now that I did that. Hold on, let me just go back. All right, so Lynn, was there anything, any chat before we move on?
So yes, someone is commenting increased training for mental health professionals and also identify and assisting increase help seeking. We do this through ending the silence with NAMI. Those are a couple of things typed in.
So encouraging help seeking, that's great.
One of the, a comment from earlier when you were asking about you know, the impacts of the COVID situation, one person said potentially a positive coming out of this is that there is more discussion about mental health in the public sphere. So that could be a positive side effect of what we're seeing.
Yes, that's definitely true. One of my colleagues, we had this discussion and said, to see mental health being discussed right at the forefront of this is something that we possibly wouldn't have seen 10 years ago. So that is a real positive. Thank you for sharing that. Okay, so again, I know we're a really diverse audience today, but here were just a couple ideas that I wrote down in terms of areas that you may be able to influence. So someone did mention training staff and parents and peers to recognize warning signs through those gatekeeper trainings and other trainings on and how to appropriately refer. Implementing some suicide screening in health centers, as well as other areas like schools, sharing information with parents about how to talk to their children about suicide, and sharing information about crisis hotlines like the National Suicide Prevention Lifeline and text lines like Crisis Text Line. Developing institutional protocols, especially in schools, about how to address a young adult who's in crisis. And then I really do, because many of you are in different health areas, I think there's a lot that we could do in terms of enhancing those life skills, resiliency, and connectedness. So you're probably already potentially doing some of those programs that promote those skills that in turn also help protect against suicide. So here's this third part of our framework, and these are the keys to success. In the interest of time, I'm not going to go through these, but one important thing is engaging those with lived experience. So engaging those young adults who you're hoping to reach, who have been impacted by suicide, whether it's whether they've attempted suicide or are survivors of suicide loss. Thinking about those creative partners to collaborate with, and then I will leave the rest there, and you can certainly delve deeper into this full model on our website. So with my remaining time, I just wanted to point out a couple resources that may be useful to you. So SPRC serves as the secretariat to the National Action Alliance for Suicide Prevention. So this is a national public-private partnership that advances broad national goals for suicide prevention. And the Action Alliance website has a lot of useful information, including a white paper that they released called Transforming Communities. This is the screenshot in the middle of the page. This outlines how states and communities can approach suicide prevention with this broad framework. Also, on the right of the screen is a screenshot of the Zero Suicide website. For those of you who have not heard of this, Zero Suicide is the foundational belief that suicide deaths for individuals in care in health and behavioral health systems is preventable. So the Zero Suicide website has lots of great tools on this framework. It's a comprehensive framework for preventing suicides in health systems. And then also I included a screenshot of the SPRC website as well. So on the SPRC website, you can find a wealth of other resources. We have different sections of our website based on different audiences and different settings. So we have a portion of our website that focuses on health and behavioral health settings, where you can find more guidance for health and behavioral health practitioners, including a suicide prevention toolkit for primary care practices. We also have a section dedicated to work with colleges and universities, including some really great free self-paced virtual learning labs on suicide prevention planning, as well as a bunch of other topics as well. And then I know many of you are in K through 12 settings. We have a couple places on our website that would be useful to you, including a section on adolescents and and school settings, where you can find a variety of resources, including this document that's on the right-hand side that includes some information about the role of high school teachers in preventing suicide. So as I mentioned, we have kind of tailored resources for settings and populations, so I encourage you to take a look at our website afterwards. And then I also wanted to highlight that there's likely a lot of good work that's already happening in your states. So you may be aware of some of these efforts, but SPRC maintains pages on our website for each state, and those list each state's current suicide prevention plan, links to state-specific resources and news articles, and also we maintain a list of state suicide prevention coordinators. So these are 1 to 2 individuals in each state who either have a formal role in suicide prevention at the state level, or someone we've identified who is the most knowledgeable about suicide prevention in their state, and can serve as a resource to connect you to what is going on locally. We also on these pages list if there are any current SAMHSA suicide prevention grantees in your state. So especially for thinking about our young adult age group, if there is Garrett Lee Smith Youth Suicide Prevention Grant awarded to your state at this time, that's a great way to tap into existing resources, because many of those grantees are doing really great work around implementing gatekeeper trainings, also working with health systems on improving those care transitions. So I definitely encourage you to take a look and get to know if there's grantees in your state. So, and lastly, I just wanted to mention that we do now have a special section of our website focused just on resources to support mental health and coping with the COVID-19 situation. So I know there are so many resources out there right now. We're trying to keep a good running living list of the best resources that we can find on these topics. So I've put the web address on these slides. Please do feel free to visit that as well. So with that, I will just pause and see if there's any questions that folks have before I turn it over to Sarah.
Carrie, as people are typing in questions into the chat box, and I can relay those to you, a couple things that stood out from the chat while you were talking that I think are worth mentioning. There were a lot of great comments. Several people are commenting about, one, their concern about young people who might be in an abusive home and their increased time, being forced to have increased time in that home with their abuser, that's a concern for many people. Also having increased access to substances and increased time with substances. Several people also mentioned they're working with young people who have developmental disabilities and concerned about how to reach young people with developmental disabilities virtually, and the additional challenges that might present, and that there often seem to be mental health resources or resources for young people with disabilities, but not developmental disabilities and young people with mental health. So the dual diagnosis. A couple positive bits that were in the chat box. Joan Blackburn, I don't know where you're from, but she said that her high school and the high schools in her area, one day they were all required to attend a training on mental health wellness basics. So I thought that was a great idea, making that part of the school day, their online learning. And someone else mentioned perhaps a side benefit is the increased speed to which young people are able to access telehealth, that this is forcing us to move telehealth protocols along, and so that some young people might have better access to mental health support through that.
Great. Yeah, I think we could probably spend an entire hour talking just on supporting those youth who are either living with developmental disabilities or those who are living in abusive situations. I think one, just in the interest of time, I'll just say a couple things. One, I think that's where it's really important to find those organizations that are trying to reach those individuals. And I'm curious if anyone who's on today can share anything that they are doing to reach that population. And then also, that's where we do want to keep thinking about how can we train those who may come in contact with those individuals, whether those are teachers or peers, to recognize those signs of both maltreatment, but also signs of suicidal distress or crisis. Okay, well, so I've included my contact information here. Feel free to get in touch with me if you have any questions after today's event. And with that, I'm going to stop sharing and pass it along to Sarah.
As Sarah is putting her slides up, I just wanted to mention several people have asked if the slides will be available after the webinar, and yes, they will. We'll make sure that you all have access to the slides as well as an archived recording of the webinar, so those will be available and we'll send them to you. Thanks, Sarah. Go ahead.
Okay, great. Good afternoon, everyone. I hope everyone is doing well and coping with the current situation. I'm Sarah Gorman. I'm from the JED Foundation. For those of you who aren't familiar with us, we're a nonprofit in New York City that focuses on young adult mental health and suicide prevention. And we serve young adults ages 13 through 30 and mostly focused on the high school and college settings. We were founded in 2000 by a couple, Phil and Donna Satow, who lost their youngest son, Jed, to suicide when he was a sophomore in college. And they set out to really understand what can be done, especially in the higher education community, to prevent this from happening again. And ultimately, we developed a comprehensive approach to mental health promotion and suicide prevention that forms the basis of a very systematic program we have called JED Campus, where we work with colleges and universities over the course of 4 years to understand sort of where they are in terms of their mental health and suicide prevention programming and help them to improve. And we actually, a couple of years ago, decided that we wanted to move into the high school realm as well with a similar program that we're now starting and piloting to help high schools and school districts across the country understand how they're doing in terms of mental health and suicide prevention program, and how to really improve and have a comprehensive approach to these issues. So I wanted to talk a little bit today about a specific program we have that targets high school age students. And it really focuses on how to prepare students for the transition out of high school and into adulthood. And we know that this is a really important topic. We've done a lot of research on this, that a lot of students, when they get to college or when they graduate high school, wherever they might be, that they really struggle with handling adult responsibilities, and that this actually affects their mental health. And if you look at the one of the slides that Carrie showed with the different components of the comprehensive approach to suicide prevention, when she talked about that upstream area with life skills and resilience, that's really where this program focuses, where we're looking to improve students' skills. So I just want to tell you a little bit about the research that informed this program, and then I'll explain to you what offerings we have as part of it. So we did a very broad survey of about 1,500 first-year college students across the United States. And we found that a high percentage of them were actually really struggling with their transition into college and with dealing with their first year. And so you see here, these are just some of the high-level statistics that we thought were the most important to highlight here. 77% feel that social media, TV, and movies make college seem a lot more fun than it actually is. And 49% feel that college is not living up to their expectations. So students are going into this experience with the expectation of something really grand and marvelous, and they're finding that it's much harder than they thought it was, and that they weren't prepared for that. Perhaps on the brighter side, 63% talk to their parents regularly about how they were adjusting to the new lifestyle. So that just really highlights how important the family members, the role they have to play in helping students with this transition into adulthood. And there were really a lot of social challenges. 54% said they felt making new friends was a challenge in college. And importantly, nobody seemed really willing to talk about this. So 45% felt like it seems like everyone has college figured out but me. And 65% tend to keep their feelings about the difficulty of college themselves. Now, we know from our own research that it's not true that everyone has college figured out. A lot of people are struggling with the same difficult feelings and emotions, but they're not talking about it. And they're really struggling with the gap between what they thought college was going to be like and the struggles that they're facing. So when we dig a little bit deeper into the data, what we find is really at the essence of this, 60% of students wish they had gotten more help with emotional preparation for college. So what we really find is that and you'll see this in a couple slides, a lot of students feel that they have good preparation from an academic standpoint, or at least adequate preparation from an academic standpoint, but what they're really struggling with is the emotional side. How do I live on my own? How do I behave like an adult? How do I do things for myself? How do I deal with failure and disappointment? These issues are very difficult. And you can see here that there's a correlation between feeling like you're emotionally unprepared and struggling with your schoolwork, potentially consuming substances, and actually not completing college, either taking a leave of absence or dropping out. And so just to sort of emphasize this point a little bit more, what we're talking about here are the non-academic pressures. And we delved into these non-academic pressures and to see sort of how much of a problem they were. And it turns out they really make up a large portion of what makes college sometimes very difficult for young adults. So these are, obviously things like financial stressors, but also social stressors, making new friends, figuring out how to keep in touch with people, family and friends, not where they are. And then this idea of life skills, being independent, being able to subsist on their own as an adult. So what we really set out to do at the JED Foundation as part of this research, and as a result of looking at this research, is that we wanted to be able to help people rethink college preparation. And we, over the years, have also broadened this to say we want to rethink what it looks like to transition out of high school, whether or not you're going to college. The skills that you need to leave high school and live on your own, whether in college or outside of college, are really important and foundational to thriving and not having mental health issues. So 87% of students said college preparation, for example, during high school focused more on academics than emotional readiness. So I referenced that earlier about how much we tend to focus on the academic side and not on the emotional side. And then there was a lot of pressure on students to go to a certain college. They didn't think about fit very much. They didn't know how to think about fit. And so oftentimes they were somewhere that was not a good fit for them, and that was very difficult emotionally. And then this last one, which I think is most important for the whole population of young adults who are leaving high school, no matter what they're doing after high school, is that they feel like their independent living skills need improvement. And that was really across the board. So we developed this program called Set to Go, and this is just a screenshot of the homepage of our website, settogo.org, that focuses on this preparation, this emotional preparedness for becoming an adult and transitioning into an adult life. And this, again, is that upstream. We focus on these upstream topics that ultimately cascade into helping to prevent mental health issues and suicide. So as part of this, we give, there's a lot of content on the website about life skills, social and emotional skill development, as well as making sure students become literate in mental health and substance abuse so that they can help themselves and help their friends as well. And for a while, we had this website up. We were doing a lot of workshops with schools, and over time, we realized that schools really needed something that was more concrete to work with as part of this helping students transition to adulthood. So we actually developed a curriculum. It's a short curriculum, but it's being implemented in schools in New York as well as a couple of schools outside of New York. And it goes through, it's for students, it could be for students grades 9 through 12. It's a very sort of universal curriculum that helps students develop life skills, independent living skills, as well as help seeking and help giving, especially around mental health issues or emotional issues, when to seek help, how to provide help for peers, and how to help them get the help they need, and topics like this. So that curriculum, obviously, if you're interested, you can just be in touch with me and I can actually give you access to that. And it's a free program as well. All of this is free and readily available information. So I just wanted to give a couple of examples of high schools and as well as higher education institutions that are utilizing some of this and preparing students for this emotional transition. So there's a school in New York City called the Dalton School. We've been working with them for a couple of years, and they're doing several components of this kind of a program. So they're doing annual seminars with parents, grades 9 through 12, to help them think more about how do they help their students understand what they want to do after high school, and if they want to go to college, how do they decide what's a good fit for them from an emotional standpoint, as well as a social standpoint, as well as an academic standpoint. They also host now an annual workshop with graduating seniors on how to get to know their new campus, getting involved, recognizing signs of emotional distress, and seeking help on campus. So really preparing far in advance if in case that a distressing situation comes up or they or their friends are struggling, how do they really know what to do in those situations as far in advance as possible. Also an annual workshop for graduating seniors and their parents on how to communicate in college, privacy laws that might change once the student turns 18, and how to prepare for the transition. So we force the parents and students to have those dialogues. And then they incorporate Set to Go into their senior health curriculum regularly throughout the year. And I think they're starting to do it with younger students as well. And then on the college, on the higher education side, we have a couple of colleges and universities. So University of Massachusetts Amherst is one, Wake Forest is another, just to give two brief examples, that have really embraced this concept of transition of care. So one of the things we talk to young adults about is if you are having mental health treatment in high school and you're transitioning out of high school and if you're going to college, how do you make sure that your care is not interrupted? And how do we make sure that sometimes students and parents decide that they think it's a fresh start, they might just want to stop care at that point, and we try to educate them about some of the reasons why they might want to think very carefully about that decision. So we developed this transition of care guide that's now being adapted by a number of colleges and universities across the country, where they explain to students sort of what should you do when you're exiting high school, before you exit high school, as early as 9th, 10th, 11th grade, to think about what you're going to do, how you're going to take control of your care, understand what your care needs are, and understand what your treatment is about. That's just part of being an adult, is really taking control of your health. And then how do you go through some of the practical considerations about finding someone to see or keeping in touch with your provider from home, and all that goes through really all the different options, so that planning for this is done far in advance, again, so that it doesn't become a crisis moment where a student has graduated from high school and they're on their own and they really needed to continue their care and now they don't know where to turn. So on that note, I just wanted to spend a couple of minutes after talking about Set to Go and our high school programming, just to talk a little bit about COVID-19. The JED Foundation, I'll show you a few links at the end, has developed special resources and guidance for everyone in this situation when it comes to mental health. And I just wanted to go through a couple of points for different populations that might be helpful to keep in mind or communicate with your networks. So for families in this unique situation, some of the things we recommend, I won't read everything on this page, but just to give a high level idea, obviously creating separate spaces in the home for work and other activities when children are home, making sure that they have some separation and some idea of this is a workplace, this is not a workplace. Really importantly, family activities can still continue, and keeping a routine can be very comforting for everyone, including young adults, continuing to eat meals together and talking about your day, etc. And we do encourage parents to talk to children about COVID-19 and school closures, and just make sure that what they say is age appropriate. I think the National Association of School Psychologists has some good guidance on how to do that. And they should proactively address what some of the mental health or emotional ramifications might be of this, even if currently their child is not showing symptoms. For schools, we encourage schools to continue to proactively interact with parents and students during this time, even if they feel like there aren't a lot of updates. That can really contribute to this feeling of positive school climate when there's a lot of communication from the school and people get the feeling that they're still connected, they're still transparent, and all of that, which is really important. Online lessons can be as interactive as possible. Students should have ample opportunity to communicate remotely with each other, whether working together on a project or just interacting over the course of doing homework or schoolwork outside of class. Holding town halls with parents, if possible, to get a better feel for what's going on at home. That can help schools try to adjust their response as well. And get feedback. Try to if there are ways to get information back from students and parents about how they're feeling about the school's communication and content during the pandemic. That can be really helpful as well. For states, understanding and communicating telehealth guidelines. This is obviously a big issue right now. Federal government's loosened some of the restrictions around this for mental health. So making sure that providers in the state and schools as well are clear on what the guidelines are in the state at the time. Understand where young adults are getting their information on coronavirus.
there's a lot of misinformation out there. If there are ways that you can sort of get ahead of that and post information that's correct, or dispelling that misinformation earlier rather than later, is always really helpful. And then, as I said earlier, there are 2 links here to some JED Foundation resources that you can check out. Love is Louder is a campaign of the JED Foundation. We have a whole action center there that many people are telling us they're finding very helpful in this crisis. So I encourage you to check it out. That's it for me. So I'll turn it back over to Lynn. I think we may have some time for questions. Thank you.
Thanks so much, Sarah, for your presentation and the information. We have several questions. One I wanted to highlight, someone asked a question about that they have come up against HIPAA and FERPA requirements kind of being a barrier to when they've talked about transitioning care from high school to college. Mm-hmm. Do you have any comments about that, about ways to have you seen that come up with the Set to Go program, or how people you've worked with maybe have worked within those guidelines?
Mm-hmm. Yeah, so we have a whole, in the tools section on the Set to Go website, there's a resource that we developed with NAMI, actually, and it's all, a big part of it is about FERPA and HIPAA and privacy laws and how those relate to the transition out of high school. It's a very complicated subject, and we try to actually talk to parents about it at these events that we have with parents and students as they're preparing for this transition, because a lot of times if parents and students don't know about what their rights are to get information. For instance, the parents don't know what rights they have to get information about their children's mental health or academic situations when they're in college. And so things do change when the student turns 18. So we do have a whole resource on that. I recommend looking at that, and maybe it will help answer some of your questions. But one thing I will say is that it's a little bit different in every state, and different universities have different thresholds for when sort of they notify parents about different things, because obviously everything's always up for interpretation. So it is a little bit a case-by-case basis, but I hopefully we give some good general guidance in that tool.
There's a lot of interest, Sarah, in the Set to Go program. There are a couple people are asking if you are ever at college fairs. Also, they're wondering if the curriculum, both the Set to Go and the high school curriculum that you're talking about, can be used with online learning for high school teachers. So those questions.
I forgot to say that. I do think that the Set to Go curriculum can be used in an online setting, a virtual setting. Yeah, I see someone post the link to the JED NAMI guide. Thank you. That's exactly what I was talking about. Yeah, I do think it can be used in an online setting. We haven't fully adapted it for that purpose, but I apologize, just so everyone knows, I just got back from maternity leave yesterday. So, I'm not 100% sure what updates we've made to some of our resources in light of the pandemic. But I do think I saw something about making some updates to it to make it more online friendly. And if not, then that's definitely something I'm going to be talking to my team about today and tomorrow, because I think it would be easy, and that you could take it and try to adapt it yourself too, because there's not that much that necessarily needs to be done in person. So.
Excellent. Carrie, I wanted to give you a chance to chime back in if there was any questions you wanted to follow up on. We also had one other question, if either of your organizations has any resources specifically focused on underserved minority groups. So either one of you can answer, or both.
Yeah, thank you. This is Carrie. And also, Sarah, I already said to Sarah, she's a rock star for coming back on maternity leave and doing a webinar, so congratulations. So we have sections on our website that do focus on high-risk groups. We have because we support Garrett Lee Smith Youth Suicide Prevention Grantees that are in tribal communities, we have fairly robust pages focused on AIAN populations, including videos about how some of these organizations have approached prevention with a lens of culture in tribal communities. We also have sections for LGBTQ youth and also certainly other populations as well. So I'm not sure if there were particular ones that folks have identified as high-risk groups in their communities, but we likely do have some resources specifically in those areas, but feel free to send me information. It looks like someone was mentioning African American adolescents. We do have some resources on African American adolescents. Also, I'd point to the Steve Fund if you're not familiar with the Steve Fund. And if you'd like, there's also a task force report that just came out recently from the Congressional Black Caucus on African American youth suicide as well, that I'm just going to paste here so you have it. And it also is my link that I found is through the Steve Fund, so you get both in one sitting.
Yeah, and from our end, that's a huge area of focus for us on underserved populations. And we do have our sort of biggest piece of work in that area. We have a equity and mental health framework that we actually developed with the Steve Fund. You can check that out online as well. And that was really, it's really focused on higher education. So it's aimed toward higher education administrators to understand how they can take equity considerations into account when they plan around mental health. But for our high school program, we're developing a similar lens for our comprehensive approach framework that we're doing for just general mental health for high schools, our major recommendations. We're incorporating equity considerations for all groups into that. And we just started this, so we don't have anything to share on it yet, but we are actually developing a similar framework for LGBTQ youth, which believe we're working with Rutgers on. And so hopefully that will be available in the not too distant future.
We just have a minute and a half left. And so I want to wrap up and thank Carrie and Sarah for your time. We're so grateful for your time and for the resources of your organization and for sharing your expertise with us today. Thanks everyone for participating actively in the chat box and asking some great questions. What I'm putting up on the screen now are some resources. This page links to the National Network of State Adolescent Health Coordinators. So you can see the website up on top. And so we have a specific page that's linked to mental health resources, along with a page about young adult resources specifically. So if you have any follow-up questions, you can obviously get in touch with Carrie and Sarah, and you can follow up with us at the State Adolescent Health Resource Center, or also find us on the National Network of State Adolescent Health Coordinators website. So those resources are there. And then just to point out that the third webinar in our series that we're doing this spring is tentatively planned for May 6th. And our intention was to focus on young adult males and their specific healthcare needs, although I have to say we're trying to be responsive about what's happening in the field and what are the needs of our audience during this time of COVID-19 response. And so we're figuring out the agenda, if that's going to be the most useful topic, or if there's something else that we can adapt to meet the needs of our adolescent health coordinators. And you can see as well, one thing that we're going to implement also is some bi-weekly town hall forums for our adolescent health coordinators, where we'll discuss some of the topics that you all have brought up that you've been needing support with, and sharing resources and support in that direction. So look for those things coming up. Thank you all of you for your time. The slides and archive recording of this webinar will be available and sent to you, as well as an evaluation, and we would be grateful for any feedback that you have about that. So thank you everyone, wishing you continued health and safety. Thanks for your time today.